But to be honest with you, from all we know from history and also from the AIDS movement and from our own experiences with restrictions on abortion care, this has been a long time plan that they've been very, happy to implement incrementally till they got where they wanted to go.
You
And
mean
I
the
don't
anti-abortion folks?
the anti
Yeah,
the anti health rights
yeah,
movement, the
yeah,
first birth movement, the anti everything
yeah.
movement, that really is at base a pronatalist movement, as you see, is now really coming out in the discourse. Right? We want
Hmm.
more white babies. We want to get rid of all the people of color, and so, you know, if I think if we had been more proactive and we had believed ourselves, and more people in the Congress who said they were pro-choice understood and believed us,
Right.
they might have done things in advance that were more protective. But
Welcome to the famous podcast. I'm Françoise Girard, and today I'm going to speak with Jodi Jacobson, who's based in LA and who's an activist I've known for many, many years. Jodi is a serial founder of organizations, of brilliant organizations. I met her 30 years ago, I think, when she founded Change, the Center for Health and Gender Equity, working on U.S. foreign policy and sexual and reproductive health and rights. She's also the founder and the first editor-in-chief of Rewire News, which is an online daily news service that provides very pithy articles on sexual and reproductive health and rights in the US. And lately, she founded Healthcare Across Borders, an organization that supports access to all sexual and reproductive health services, including via telemedicine in the US. So let's go and talk to Jodi. Hello, Jodi. It's really very nice to see you. Today, we're going to talk about what else? Abortion with pills and telemedicine abortion, one of the subjects that we've both worked on for many years. It's very important, in particular at this time, to talk about this telemedicine abortion and abortion with pills because so many of these states in the U.S. have criminalize abortion in one way or the other. I think we're now at 20 states and counting that have criminalized abortion in whole or in part.
in some way or another,
Yeah,
yes.
de facto. Um, and as a result, abortion with pills and telemedicine abortion have become a kind of a lifeline for a lot of women and pregnant persons in restrictive states. And now we're facing the next twist in this saga, that this lifeline may come under attack now that we have the Trump administration in place, increasingly in place. Now, assume that the folks who will listen to this, by and large, are very pro-choice, very much in favor of abortion and abortion with pills, but they might not be steeped in the material fully. So I'm going to ask you a few questions just to situate the issue. Could you explain to my viewers why are abortion pills so important today in terms of abortion services in the US? And why abortion by telemedicine is so particularly important in the US today?
Absolutely. Well, going back to when we first met and we were working on global issues and global health, you and I both know, and I think many people don't really know, that if you don't have access to abortion care, people die, and they die at increasingly higher and higher rates due to pregnancy complications that can cause death or illness,
Mm,
right? And so, working on that globally, you know the dire situation that occurs when there's no access to abortion, which has knock-on effects on families, on infant health, on child health. And so that really creates a public health crisis. So then you flip the switch and you've got the United States where until the Dobbs decision, people had most people had access to abortion care. Many still did not
no.
because Roe was a very imperfect framework. And we had lots of people who did not have access to abortion care. And the right wing in the United States did everything it could under Roe to undermine access at the state level. So Roe was not a perfect thing.
No.
But once it was gone, they had a sort of open playing field, right? Now, during the pandemic, the FDA allowed medical professionals to use telemedicine for a lot of things, including mental health care, including abortion care. And so people began to use telehealth to do that because, let's say, and I know a particular story in California, a woman living in a very rural area in Northern California who already had 5 kids and who was found herself pregnant and couldn't get to a clinic because many clinics in those areas are hours away. And so through telemedicine, one of the clinicians I had been working with was able to get her medication abortion within a couple of days. That woman was facing really dire circumstances, right? So telemedicine is an effective means of delivering a lot of kinds of healthcare, and it's only been limited because it interferes with some of the market preferences and competition of both clinic-based care and medical societies and professions. So it's an absolutely effective kind of care. And during this time when we now have 16 states with either total or 6-week bans, we are able to use telemedicine when needed to get care to people. Similarly, with gender affirming care.
And in the U.S. right now, I was reading that abortion with pills are now 2/3 of all abortions. Like the percentage of abortions that are affected with pills is growing, right?
It's growing exponentially, and I actually think that is an underestimate.
Right.
Especially now when really good data is harder to come by, but we know that people are using pills across the country and they're somewhat harder to track because you can get medication abortion many different ways. You can get them from grassroots groups on the ground, which tend to be very closely guarded because of the obvious reasons. You can get them by ordering them online yourself from abroad. And you can get them from telemedicine professionals in states with shield laws.
Right. And you could also get them from a clinic in your community. So there's all kinds of different ways. Some of them involve health professionals, doctors, some of them not so much. If you're getting something mailed from India, for example, you might not ever interact with a health professional, but abortion with pills in all its different modalities is only growing. I mean, I understand.
It's growing exponentially, and I think that it will grow as much as people can get access to the pills. And, frankly, an argument in the field is what is self-managed abortion versus what is, self-administered abortion. To me, it's kind of word salad because the whole idea is whether you get pills from an online provider that is a doctor or from an online provider that is not, you're still you're still doing self-managed abortion. And the surveys that we have show that people really prefer this because they can be in the home with a friend or their mom or whomever and be in a private space and not have to pay exponentially more for a clinic-based medication abortion, nor go back to the clinic many times.
Yeah, right. Which initially, when pills were brought into the U.S. As a more mainstream form of abortion provision, there was all this discussion as to whether or not people need to be in clinics to take the pill in front of a nurse or a doctor, and that's all become clear over time that that's not necessary. In fact, that women are perfectly capable of self-administering the pills. But I just want to be clear that that's actually a very safe thing to do, self-administration of abortion pills. And there's 2 regimens, right? There's the mifepristone plus misoprostol, 2 different medications that have slightly different functions, or just misoprostol alone. The pill can be used safely to to produce
Yes,
abortion, right?
exactly.
Right. So in the US, what has been the role then of doctors in all of this using telemedicine? Why do we need the doctors to do this? And, why do they privilege the mifepristone plus misoprostol regimen, which is more expensive? I
Right,
mean,
right.
there's a lot of questions that people might have as to.
I mean, I think that one of the things to think about is that some people are just much more comfortable speaking to a physician, and they
Mm-hmm.
should have that option, right? And they want to have that connection. And other people are just fine using the medication on their own without the assistance of a physician, knowing that if they needed to, they could potentially call a physician. Now, the problem comes up when, in the very rare instances, and it is very rare, that someone has excessive bleeding or some kind of concern
Yeah.
in states with these bans, or where abortion is criminalized at some level. Um, like, let's say it's not technically criminalized, but if you self-administer, it's criminal. Then you can have a real problem getting care.
Mm-hmm.
And since there has been a trend in US policy, frankly, internationally, for over 20 years of using health providers um, as conduits of criminalization and reporters, not reporters on behalf of the patient, but on behalf of the police. Sometimes people are afraid to go with real concerns to the hospital because they're afraid they're going to be reported to the authorities. So
Yeah.
they don't get the care they need,
Mm-hmm.
which
Mm-hmm.
is really so antithetical to the individual's rights and needs and health.
Mm-hmm. I mean, what you're saying is really something that we've been saying for a long time, which is
Yeah.
that there should be a range of options offered to women and pregnant
Yes.
persons so that they can access the one they're more comfortable with. And that's also true in contraception. We shouldn't be
Everything.
pushing one form of contraception. We should offer the full panoply of methods, and people can choose what works for them. Similarly, I guess this is what you're saying with abortion. If some people would like to talk to a doctor, they should be able to do that. If some of them prefer to deal with a grassroots organization run by feminists who will accompany them, that's another option. If some people
Right.
just want to read something off the web and then order directly and then deal with it themselves, but at all times should there be any concern, or the bleeding is more than they expected, or they have very heavy cramps, whatever, an option to then seek care without getting reported and arrested, which
Exactly.
is not so sure now in those states that have criminalized abortion. There's a real risk that you may be denounced, or that they may be grilling you as to who gave you the pills and who helped you and so on, because a lot of these laws target the providers, right? The doctors.
Yes.
Yeah.
Yes,
So,
and I would say
yeah.
that, if you think about it from the vantage point of the United States, where everything is a market response, right?
Mm,
We could go into a grocery store and see 50 different boxes of cereal.
yeah.
And why are they there? Because someone wants this kind of Raisin Bran, someone wants this kind, someone wants, um, all the different things that people ask for and demand, they get served.
Yeah.
But when it comes to reproductive health care, someone out there wants to say you can only have this, and if it doesn't fit your needs, you're out of luck.
Yeah.
And it's crazy when you think about it that way, that the most mundane thing has a market response, but the most essential thing of healthcare doesn't.
Mm-hmm. That's very true. And so there's a group of doctors since the Dobbs decision. Dobbs was rendered in June 2022. That's when the federal right to abortion, the constitutional right to abortion, was declared null and void by the Supreme Court of the United States. And we entered a very different era of state-by-state regulation of abortion, with all the contradictions that we're facing. But we've seen a number of doctors in states that are permissive, if you want, where the right to abortion remains guaranteed by state law and state constitutions. We've seen them willing to use telemedicine to talk to pregnant people in states where it's restricted and prescribe over Zoom and then, or telephone, and then mail them the pills, right? So that's a group of doctors that have they Do we know all of them? Like, do we know who's doing that? Or is there possibly some people doing it and we just don't know about it?
For the shield laws,
Yeah,
under the shield laws. So there are a large number of people who are doing telemedicine abortion in states where abortion is still legal and
yeah.
who are trying to expand access to care.
Within their
And then,
state, you mean? Yeah.
right, right, right. And then there are there are folks who are using shield laws. There's probably about 10 of them now who are using shield laws in different states to help protect them from extradition or the seizure of their records
Mm.
or effects on their medication on their malpractice insurance. Those shield laws in places like California, Washington State, New York, Colorado, Massachusetts was the first state to pass a shield law. It's a very strong one. I believe the California shield law is the strongest of all because when we worked on it, we had all of the input of all of the other laws that had already been passed, and we went further because we were approached by folks who are working in, for example, the trafficking community or in helping people who have been raped or sexually abused by an intimate partner, um, who are considered aiders and abettors
Mm.
by some laws. So we folded everybody into that law. It wasn't just about the physician or the pharmacist. It was about anybody
Who
that
helped
might be
the
affected.
person? Yeah.
Exactly.
Hmm.
Exactly. So under those laws, there's still risks involved, without question. Any physician that's doing that work has almost certainly had to give up their licenses in states to which they are sending medication abortion where abortion is illegal.
And why
Be-
is
be-
that?
because what happens is, let's take a hypothetical situation
Yeah.
that a provider, a clinician in Colorado, gets a call from someone in Texas and is asked to provide medication abortion, and that person is provided with medication abortion in Texas. But if in fact Texas were to somehow litigate that case and a mark went on the physician's license in Texas, it would affect their ability to participate in federal programs like Medicaid and Medicare.
Ah,
So any kind of black mark on your license affects your license. So it's easier to just give up your licenses in those states, which is obviously, again, it's
yeah.
a prevention tech, like a sort of a legal prevention technique,
Yeah.
but it also is a costly thing eventually to the provider who's giving up something that they earned. So yeah, it's there are a lot of different considerations. The clinicians can't travel through the states that
Right.
they are fighting to
Yeah.
because they would technically be able to be arrested there irrespective of any shield law. So you can't even go through an airport,
Right.
like can't make a trip from Washington State to Washington, D.C. and go through Houston.
Yeah. Yeah.
Right?
Yeah.
So there are a lot of different things that you wouldn't immediately think about that come into play that sort of the providers have had to consider and make accommodations for.
Right. And these shield laws were passed after Dobbs in
Yes.
2022. Basically,
Yeah.
once the states that decide to really improve their protection of abortion rights looked at, what they needed to do, one of the things they realized is that they need to protect their own physicians from, prosecution and extradition to states
Yes.
that are
Yes.
restrictive. I mean,
So there are two kinds. There
yeah,
are two kinds. I just want to be clear. The kind that protects, for example, Planned Parenthood providers in New York
yeah.
who might see a patient coming from Florida or
Who
Texas,
comes to New
um,
York?
who comes to New York for care. Those shield laws protected Planned Parenthood from extradition or lawsuits or what have you. They couldn't protect the patient once they left the state, but they did protect those providers. Um, those laws did not protect telemedicine across borders.
Right.
So other laws had to be passed, or those laws had to be amended to make it clear that these other clinicians were also protected. And Massachusetts was, I think, the first one to do a interstate shield law.
I mean, it's wild if you think about it. Like, it just blows my mind every time I think about it that doctors have to be protected by their own state where they live against, Texas or Florida or whoever, whichever state
Right.
might try to have them extradited for criminal prosecution. It's wild. I mean, it's just
Yeah.
unbelievable.
I mean, to
For
be honest with
practicing medicine, for doing something that's
yeah,
perfectly safe and yeah.
right. But to be honest with you, from all we know from history and also from the AIDS movement and from our own experiences with restrictions on abortion care, this has been a long time plan that they've been very, happy to implement incrementally till they got where they wanted to go.
You
And
mean
I
the
don't
anti-abortion folks,
the
you mean?
anti
Yeah.
the anti health rights
Yeah.
movement, the
Yeah.
first birth movement, the anti everything
Yeah.
movement, that really is at base a pronatalist movement, as you see, is now really coming out in the discourse, right? We want
Hmm.
more white babies. We want to get rid of all the people of color, and so you know if I think if we had been more proactive and we had believed ourselves and more people in the Congress who said they were pro-choice understood and believed us,
Right.
they might have done things in advance that were more protective. But
But here we are. And I
here,
was really shocked to hear from Healthcare Across Borders that there are so few doctors
yeah,
doing this cross-border, cross-state border telemedicine, abortion provision, like seeing patients by telemedicine and then mailing the pills to Texas or wherever, to
yeah.
Oklahoma, whatever. There's not many.
No, we were originally working with 16. And then after the election and and then again after Louisiana indicted one of the clinicians, um, several dropped out. And, everybody has a risk analysis that they have to make for themselves.
Mm-hmm.
And it's very personal because there's risk involved in everything, right? But you have to make your own decision. And lots of people, for example, did not want to give up the chance to travel to a state like Georgia where they have family
Yeah.
or know that they're already more likely to be criminalized because they're Black and they're a provider. And so, we have fewer now than we did, and the volume is growing. So those clinicians are really seeing a tremendous amount of demand.
How many patients or pregnant persons do they
So
help
I can
every
safely
month?
say, and I'm not sure that the number hasn't changed upward because of various things I'm still waiting for, but I can safely say it's over 10,000 a month.
How do they manage? There's only 10 of
They
them.
are constantly working. They do have people helping them. But it's a huge load.
It's
And
mind-boggling.
the difference here is that the clinicians that are working on shield laws are charging roughly $150 per client. And about a fifth of the clients can't afford to pay the $150.
Mm-hmm,
They
mm-hmm,
might be able to pay a portion. They might be able to pay $5 or
mm-hmm.
$75. But those losses, they get care anyway. Nobody's turned away.
Right.
Even if you can pay zero, you still get medication abortion in 3 or 4 days. So it's basically a donated form of care that then comes out of the pockets of the providers. And when you think about of that $150, an entire half of it is taken up just by the medication,
Right.
never mind, the call center and the malpractice insurance and all the other stuff.
Mm-hmm.
It's not like anybody's getting wealthy off of this. So what we try to do is, in cases where we can, we try to make up the difference of the losses. Of our ability is a very small share, but it's helpful.
Right. So that's one of the things that you decided you and Healthcare Across Borders could contribute, right, to help
Yeah, yeah,
mitigate the economic loss for
Exactly.
these physicians. And of course, for people in other countries, they must say it costs, $75 for abortion pills. That's very high, but this is the US, right, where
Right. Right.
the medication of all kinds is very expensive.
Exactly.
It's not that expensive abroad. So,
I know people
yeah.
can get it up over a counter.
Yeah, for very little money. Misoprostol, I think, is 25 cents a pill or something. Not
Yeah.
even. Yeah,
Yeah.
yeah. You mentioned Dr. Carpenter getting indicted in Louisiana. That's a physician. We saw this in the papers last week. That's a physician based in New York State who was mailing pills to Louisiana, to patients in Louisiana, and now Louisiana has indicted her, criminally indicted her, right?
Yes.
Yeah, so but she's protected because of the shield law.
New York has said it will honor its commitment to protecting
Yeah,
Dr. Carpenter.
wow. But that's very scary because that could change. You could imagine
Absolutely.
a different
Absolutely.
attorney general in New York or, a different governor. And
Yeah, I mean, I think that, the real issue here is that these cases are coming up so that they get tested in court
yeah,
and so that the shield laws get tested in court. And the aim for the people who don't care whether people die or have health care is to contest the shield laws and have them found to be unconstitutional. So, that's a real risk.
yeah,
But in the meantime, people are working really hard to provide care. And I don't want to undersell the fact that lots of other groups are also working really hard, like Red State Access and other groups that are more grassroots oriented and do things differently, but are also helping many, many thousands of people throughout the country. There's a lot of different ways people are getting care.
right,
And some of it you don't want to talk about too openly because you don't want people to be targeted, right? But
right,
there's a lot of different ways people are getting care.
right,
I know of a small group of people, I'm not even going to say what state it is, who are working full time at other jobs, but who collect whatever money they can every month and help to try to get 20 packets of pills to people every month.
right,
And then there's folks who are hairdressers in certain places who are known to be the people that have stuff to give people. So,
right,
there's just a lot of, as if you go back and this as well as or better than I do, if you go back and you read the literature about what people did before Roe, that's what they did.
right,
They helped people sort of in the underground space. And we're going back to that place, which is a bad place to be because many people don't get care. And we are already seeing in Texas, for example, the United States has one of the worst maternal mortality rates, deaths due to pregnancy in the world,
yeah.
especially at the level of economic development that we
Amongst
are, right?
industrialized rich countries.
Yeah,
Yeah, yeah,
really one of the worst.
yeah,
And in Texas, as you can imagine, Louisiana, it's really awful. It's among the sort of averages, they pull the average, right? So in Texas, you had really high rates of Black maternal mortality that even as early as 2012 and 2013, people were documenting and raising alarms about how high Black maternal mortality in Texas is and
yeah.
was. And now we have found that post Dobbs, it's skyrocketed even from there. So the number of women and Black people who are dying from abortion, I mean, pregnancy related complications has grown. And then there's also a steep rise in infant mortality as a result of Dobbs in Texas. So, these individual stories that make it to the press and that are heart-wrenching are just examples of the things we don't hear.
Right.
And we don't know how much we don't hear because, one, for example, the Texas government has decided not to collect maternal mortality data anymore.
That's right.
That's just a way of saying
I was
we're
shocked by
just going to
that.
hide reality.
Yeah.
I mean, it's insane to me, but it's also very much in keeping with who they are in
Right.
that government.
Right. So that's very disturbing when I saw that, we have a major problem of maternal deaths. We're just going to stop collecting the data.
Right. Well,
This
it's
way it
in
will go
keeping with
away, you know.
what Trump said during the COVID epidemic. Well, we don't want to count them because they might be higher.
That's right.
I
Let's not
mean,
test because we don't want to find
right.
out. Yeah, 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 yeah. It's extremely scary. Um, Now, you were talking about the fact that the shield laws, the laws that protect doctors, are, their strategy of the anti-abortion, the pro-birthers, is to get those laws tested in court and maybe found to be unconstitutional or whatever. I don't even know how they could do that. But there's also the risk, that a federal law is passed, to supersede this, isn't there? I
Yes,
mean, if Congress
absolutely.
passed a law that bans abortion at national level, could it then uh, attack those shield laws and basically expose all the
Absolutely.
providers?
If
Yeah,
there's a
yeah,
federal law, it's a completely different scenario. People won't be working with the protection of shield laws if they
yeah,
do, provide care of any kind, even the kind of care that would be necessary to save someone's life because they have, you know, a third trimester pregnancy that's gone terribly
right.
wrong, the fetus has died, but they will basically be just left to die. And um, it's it's both horrifying and deeply immoral, and also somehow we have let these people get away with it. And it
Yeah,
just, yeah,
yeah. I think that's a conversation we've had periodically in the feminist movement about why did we concede so much. I don't think you and I conceded a whole lot, if anything at
right,
all.
no, yeah,
But yeah, many people were willing to, well, maybe we can compromise on this, we can,
right.
and it none of it has served the movement and women's health, and yeah, none of it.
I
Like,
think of it like sea level rise. It's like you've got a beach, and this beach is constantly being eroded by compromise after compromise after
hmm,
compromise until suddenly your whole city is flooded
yeah,
because there's no barrier left. And for me, I kept asking, well, where's the end of these compromises and what are we getting back for them? Nothing.
hmm,
But it kept happening. And so, yeah, here we are.
yeah, and now it's the entirety of women's health and, frankly, of healthcare that is at risk because we've conceded a major life-saving
Exactly.
health intervention, and then contraception's next, and gender affirming care for trans person, and then it just goes on and on. Basically,
Exactly.
nothing is safe from this witch hunt of DEI. I mean, we heard RFK during the his testimony saying that Black people had a different rate of what was it? They're
Yeah,
less subject to
yeah, a different can't remember what it was, but yeah, different, some sort of different level of,
infection
yeah,
rates or
yeah,
whatever. Yeah,
yeah.
I mean that is
I
of
mean,
course
he's so
false.
insane that I just can't even listen to him talk. I
That's right.
just really
I
can't.
know, but it's false, and here we are. It's not, to me. That's not different from. It's all connected.
Yeah,
Once we let go of science, because with abortion, science was on our side, then
right.
everything
Everything
unravels.
I read.
Right, right.
Yeah. I
Uh,
mean, with RFK, and the media is at fault for this. I would see story after story. Well, RFK is pro-choice, so la la la. La. And I'm thinking, none of these people are anything they say they are today because they're so transactional that they might be something different tomorrow. There's no core belief anywhere there.
yeah,
And if you have a core belief, you don't change it from day to day.
no,
You change it because the circumstances have changed, but you don't change it because someone tells you it's better for you if you change it. You know what I mean? So this is the kind of politics we have now. And too many Democrats also participate in this.
yeah, no, for sure. So, what can people who want to help those brave doctors and health providers, health personnel that are helping women in their, within the state where and across borders do? Is there a way to help
Well, we
your
do
organization?
have a 501(c)(3 that
Hmm.
people donate to for helping us support
Yeah.
care that they are providing via small reimbursements that we give them. Those are ways that people could help. They could
Yeah.
we have an AppBlue account. It's totally a 501c3. So yeah, people could do that if they wanted. There's also Women on Waves, which is in Canada,
Yeah.
and they're another group that provides care. So I don't know the processes for other groups like Red State Access, but there could be donations made there. There's a lot of different ways to help people get
Yes.
care to other people.
We'll post all the website addresses so people can come and help. Well, thank you, Jodi, for everything you do, your
Thank you.
courage and your boldness and your pioneering spirit. You're always at the forefront of the issues. So thank you, and let's keep up the good fight, as I say. A luta continua.
Yes, a luta
continua.
continua. Thank you so much, Françoise. Love to see you.
Take care.
Bye.